Hello, everyone. Thank you for joining our webinar, Automate Your Authorizations with MedeAnalytics and Recondo. In this session, we will share some of the exciting capabilities and new enhancements of our patient access solution, thanks to our partnership with Recondo Technology. My name is Michael Sandvig, and I will be moderating today's session. Before we begin, I wanted to let you know that this session will be recorded, and a copy of the playback and slides will be sent out in the coming days. If at any time you have questions for our presenters, you may ask them through the Q&A panel. Be sure to direct those questions to all panelists using the drop-down menu, and we will answer the questions at the end. I'd now like to introduce our presenters for today. Troy Andrews is the product manager for our patient access products. He is responsible for the strategic direction and delivery of patient access. Andrew Vanisic is the Vice President of Product Integration at Recondo Technology. I'd like to now turn things over to Troy, who will start us off.
Thanks, Michael. So this is Troy. I'm the product manager for our patient access product. And we are really thrilled about our relationship with Recondo. The technology that they bring to our patient access product is really terrific. So we'll see some of that today. What I want to show you first is a little demo of how the patient access product works. I know some of you on the call have seen it and some of you haven't, but we'll take a look at that first. So Michael, are you ready for that?
Yes, please take it away. Assuming you have controls, that would be great. Thank you.
Okay, great. So the patient access workflow is a task-based system that is designed to financially clear a new patient during the registration process. Some of the work can be done ahead of time. Some of it is done by the registrar when the patient is sitting in front of them. The tasks use a red, yellow, green marker to let you know that a task is complete and you don't need to pay any attention to it. A task is in process. There is something going on with data that's being changed or work that needs to be done. Or a task is red, which means the registrar, the user, needs to pay attention to it. It is a real-time data exchange between the host system. So the facility system will create a registration. They'll send that registration information into patient access, and we create an account here in patient access, and the registrar then works through the tasks. The Recondo system is integrated into the patient access tasks, and what we're going to look at today are mostly the tasks that Recondo is involved in. There are additional tasks that a registrar will also need to perform, but I want to focus today on the ones that Recondo is involved in. And then Andrew will tell us a little more about the Recondo products and how they're, what they do and how they're moved through the patient access product and how they're integrated with our system. So we'll take a look at the tasks themselves and how they work. As I said, there's a real-time data flow between a hospital system and patient access, and a real-time data flow between patient access and the Recondo system and the Recondo products. So when a Recondo function is run, it will do what it does and then communicate back with patient access, update the task, and in many cases, complete the task for the registrar. So I want to just take a look at the tasks themselves and how they work. Again, the purpose of patient access is to financially clear a patient, to get them from when they walk in the door to complete the registration process through to eventually collecting what the patient owes for that particular visit. And Recondo is involved in several of the tasks that a registrar will perform during that process. So the first task is what we call registration edits. Patient access uses an HL7 file to create an account. So the hospital system or facility system will create their registration. That creates an HL7 file. that HL7 file is then sent into MedeAnalytics in real time, and we create an account. The first task checks that HL7 file for making sure that the data in the file is correct. You don't have a number in the patient name field, there isn't data missing from the registration, and it sets what we call registration edits. And these are, there is a piece of data that's incorrect in your registration, and you need to go back and correct that data in the host system. So the registrar would then go into their host system, into their registration system, make any necessary updates, and as they make those updates, that data is then sent back into patient access and updates this task and completes it if the registration data is incorrect. Next task is insurance verification. And this is where Recondo starts to get involved. So we look at the registration information and let the registrar know that according to your HL7 file, there are 1 or 2 or 3 insurance involved in this particular patient. And we look for particular things that if the patient is over age 65 and you don't have Medicare listed as one of the insurance providers for this particular patient, this task alerts the registrar that they need to check that particular insurance as well. Next comes the authorization. Once the insurance is verified, that this is the coverage that this particular patient has, we then start checking the visit itself. And here is where the Recondo integration really begins. And as you know, the industry has been slow to adapt an electronic authorization. So many payers require that services are authorized, but the electronic version of that authorization is not available from very many payers or available from many clearinghouses. So Recondo has created some technology to automate the authorization process, and that service is integrated inside patient access. So Andrew will talk a little bit more about this in detail, but what happens is a Recondo technology is used and AI is used to access the payer's authorization portal, submit the services that are on the claim or on the registration to be authorized, authorize those services, and then communicate that back to the patient access product, and it's updated in this task. So what you will see here once Recondo is really in action is an authorization number, what was authorized, what Recondo discovered during that authorization process, and there are links to the payer website. And there will be a link to the Recondo website. So if a user wants to find out what happened during that authorization process, they can link directly into the Recondo website through single sign-on, find out what the Recondo technology did during that authorization process, view that, and then return to the patient access product. Next is a notified payer task. So when a patient moves from outpatient and is admitted as an inpatient, the facility has 24 hours to notify the insurance payer that the person has become inpatient. Recondo also has a notified payer technology that uses the same sort of AI, goes out to the payer's portal, notifies the payer that a patient has been admitted as inpatient, and then reports that information back to patient access, and would update all of these fields with the information that they get during that notification process. Next is a medical necessity check. Recondo has built a product that does a medical necessity check on the services that are being provided, both for government and commercial payers. They have used the payer's medical necessity data that's available, created rules built around that, and when services are provided, they submit those services to a medical necessity check with the payer, discover if services are going to be paid for or if a payer considers them unnecessary or require payment directly from the patient for these particular services. The Recondo technology lets this task know, and then that is added to the patient responsibility amount when the registrar is ready to collect some money. And next comes a patient estimate. So, excuse me. So once we did the insurance verification, the 270 file goes out to the insurance carrier to say, is this person covered? A 271 file comes back that has coverage information for that particular patient. So copay, coinsurance, deductible, remaining deductible, family remaining deductible, all of that is included in the 271 file, and all of that is used by Recondo to create a patient estimate. So they will have on file all of the facility's contracts. They'll use that contract, they'll use the services that are billed, they'll calculate patient responsibility based on those services. What is the patient's copay, coinsurance? Is there any remaining deductible? They will take any non-covered items from their medical necessity check, add all of that together, and tell the registrar, for this visit, this patient's responsibility amount is $500, and then gives that registrar an opportunity to collect all or part of that estimate from the patient while the patient is sitting there in front of them. And there's a link to a PDF, which is a statement that you can print out and hand to the patient to say, here is what your services are going to cost, and how much of that do you want to pay today. And the last task that we'll look at here is a collect payment task. The registrar can collect all or part of the payment. The estimate amount will be added here where it says not created. It will have the patient's estimate amount in there. The registrar then collects an actual payment. That updates the collected field, and there's a notes field here that the registrar can use to talk about what they did during that process. Most of the tasks include a follow-up day. So if they are unable to complete a task today, or if they want to follow up, they want to collect a portion of that payment from the patient today and then follow up with the patient in 30 days, they can set a follow-up day that will move the task from green complete to red incomplete to tell the registrar that they need to go back to this task and complete the task, in this case, collect the additional money that they scheduled 30 days from now. All of the tasks can be completed individually, and there's also a view of all of the accounts, what tasks are complete and what tasks are incomplete. You can then work through each of the tasks from this account view. You can check authorization or recheck authorization. And as I mentioned, any update that is made into the registration system is then immediately sent into patient access to update that information there as well. So that is a brief overview of the patient access workflow. It is, as I said, a task-based workflow designed to financially clear a patient, and we are thrilled to work with Recondo to make that process as smooth and automated as possible. I'll stop sharing my screen now. Michael, back to you. So here's some information about our partnership with Recondo. So MedeAnalytics has created the Patient Access Intelligence Solution. It leverages the best-in-class vendors to make the best product it can be. So in addition to using Recondo's technology, we use Axiom's address verification and financial counseling product, which is something that enhances the patient access system itself with best-in-class vendors that are able to assist a registrar in completing those tasks and financially clearing the patient. Medi and Recondo are better together. So Medi brings a workflow, and Recondo makes that workflow better. So whenever possible, if a vendor can do a better job at completing a task in patient access, we get that vendor to do a better job than Medi could do by itself. And both companies are really laser focused on the patient experience during registration. That one of the things that we always want to remember in developing a program like patient access is the patient in patient access. The patient experience is a big part of the success of any facility. So whatever we build should be built so that the patient benefits as well as the facility. And then Recondo, really one of the best and most innovative software vendors today. The AI technology is really superior to anything else that you're going to see in this space. And I'll certainly let Andrew talk about that a little more in a minute. So next slide. So as we mentioned, the 278 electronic verification process has been slow to adopt by payers and clearinghouse services. Recondo's auto authorization fills a significant gap in the registration process. Services are authorized by the payer without human intervention, and working together, MedeAnalytics and Recondo are making healthcare better by creating efficiencies and preventing denials. Obviously, preventing denials is a key to things like prior authorization and notify payer of admission, that those steps have to be done, and together we are trying to automate that process as much as possible. So next slide. And we saw this already, so I think we'll turn it over to Andrew from Recondo.
Thanks, everybody. I want to touch briefly on some of the outcomes we see with the joint solution here, because I think it's sometimes hard to demonstrate what the value of good content in the revenue cycle is, and I'll talk about what content means. But first I'll talk about some of these outcomes. So we've seen in scenarios where we've been able to benchmark ourselves against the competition, 55% less eligibility denials. And it's not uncommon to hear stories of, taking a patient access operation that is currently experiencing, let's say, 10% of their overall denial volume is eligibility related, and take it down into, single digits, like 1 or 2%, and doing that in a very fast time, right, in under a year. And you can imagine, right, the benefits that come along with that. Capturing more payments, right? That sounds like an easy thing to do, but underneath that is a lot of complexity in determining, well, what's the patient's out-of-pocket estimate, right? Do you have the right benefits to be accurate with your calculation? Can you automate this such that you generate more estimates to have that financial conversation earlier in the cycle with the patient? And some of those results we've seen clients be able to collect on an annual basis, 4.3 million more, because they have those rich benefits, they have the out-of-pocket information to have a discussion with the client. If I talk about, maybe gloss over a few other of these, I don't necessarily need to go through the whole slide. But how do we discover more benefits? Well, it's a combination of identifying those gaps in EDI, where we know that a certain benefit does not exist, and we know it exists on a payer portal, and we're able to, fold those together. But it's also in the normalization and the accuracy rules of the data, right? How a Blue Cross Blue Shield plan responds with radiology benefits is different than United Healthcare and is different from Cigna. So if you don't have the logic or rules to make those determinations about how those benefits apply to the coverages, right, you could be looking at different copay amounts, different coinsurance amounts. You're getting long out-of-pocket information. And then finally, as we talked about with authorization, which I think we're seeing a lot more interest in, is being able to automate about 80% of the process of just going out and securing a status for that authorization. I think with the payer coverage, right, with the lack of EDI, to payers using that 278 methodology and using our bot infrastructure, right, we're able to cover about 80% of a client's payer base and really start to drive significant savings, where we're seeing, an FTE equivalency of anywhere from low single digits to 12 to 15 employees in the operation. And what that really means is that as organizations are growing and centralizing authorizations, they're able to take on more work, right? Now you combine all this content with the workflow that you see, and now you have a very nice visual system that can deliver better results. We can go ahead and go to the next slide. So how are we integrated, right? We have a lack of integration capabilities on the back end. So whether, right, your organization is, experienced with using HL7, batch, XML, you have EDI experts, you need to do user emulation, or in this case, we're using RESTful APIs. We can drive a lot of workflows across a lot of different implementations. Where I think I see the value that's different with Medi and Recondo is that RESTful API platform. We can exchange data faster. We have more ways of getting more content than you could using these other technologies. And it really makes for as Troy was indicating, a more seamless experience, and it's more holistic across the revenue cycle. So we're really excited that they're a partner using this platform because it's getting that extra value of content. We can go to the next one. So I'll discuss like what is content, right? It's a nice big word, but I really boil it down to 4 things. And the first one being, are you getting the actual data elements, right? Are you getting eligibility determination? Are you getting the right service type code level benefits? Are you being able to detect, potential that come with that, right? Are there replacement plans on file? Is this plan only covering, pharmacy benefits, right? There's a lot of information that you can start to secure ahead of time to progress and financially clear your patient. It's things like getting the authorization status of an account, getting certification numbers, being able to look at substantiation images from the website to fight, potential denied claims where you believe your operation has secured authorization, getting a patient estimate up, right? Those are kind of the data elements that I think of that, help drive those conversations. But the content's also something that is a little bit deeper, right? It's the accuracy and the automation of that. So being able to make sure that you're looking at the right benefits, that you have more connections to payers in an EDI and bot type format, that you're able to look at something like an estimate and compare it to a remit and determine how accurate that estimate was. All of those types of things help drive that accuracy and automation. And that itself is, manifested obviously by a data element, but there's a lot of logic that goes behind creating those pieces of data. Rules and policies, right? So if you're looking at like authorization rules, right, just determining whether a plan requires authorization for like high cost or high-end imaging studies. We have over 1 million curated auth rules that can help you answer those questions ahead of time and remove those unproductive touches out of your system. Meaning that, right, hey, if authorization isn't required, there's no need to work it, right? If you're touching those type of accounts, that's an area where you could gain efficiencies. Same thing with status, right? If you check a status and find it certified in total, that's great that you obtain that information, but in actuality, if that can be automated, then that's a touch you don't need to take, right? So all these rules and policies help drive downstream workflows, and you can access that content through the Medi-Recondo partnership. And then finally, I'll say that, as you kind of saw in the visualization layer of the platform, right, the alerts and next best actions, right? Hey, I'm getting an alert that's telling me there's an issue with this account and I need to stop, right? I need to fix this before it becomes a denial on the back end, right? So to the extent we help you identify CPT mismatches in authorization, location discrepancies where you're authorized in one place of location but not another, looking at eligibility about do you have the right plan code selected so you're getting your bills to go to the right payer locations, looking at PPO HMO alerts, or even detecting if something's in or out of network. Those are all types of content that alert users to help take the next best action. So that's the holistic picture of how content is helping drive these outcomes that we've seen at our mutual clients. Thank you, Michael and Troy. I'll hand it back to you guys.
All right. We've touched on a lot of this during the webinar, but just to repeat that, really the integrated services are something we're really proud of. I mentioned we have several vendors that we're integrated with, Axiom, Recondo, and that really improves the patient access workflow from the tasks that need to be dealt with to the tasks that automation and technology can deal with. So through Recondo, patient access customers can take advantage of medical necessity notifications, insurance verification, payer notification of admission, patient responsibility, patient statements, all from within the workflow. And, a better patient access workflow tool creates better analytics. So one of the things that MedeAnalytics can offer with all of our services and with patient access is an analytics component that looks at everything that's going on in your revenue cycle. So we have real-time user productivity reports. We have send a batch of data from the activity during the day into our analytics tool overnight. You can look at really every aspect of your registration process and every access of your revenue cycle management, how much was calculated as what should be collected from a patient and how much was collected during that previous day. So it really combines the best possible workflow tool with the best possible analytics tool. So we are really proud of how this has all come together. And our goal is to financially clear a patient in as easy a way as possible, to increase your productivity, to increase your collections, and do that together with Recondo and our other vendors. So let's take a look at the next slide. So we have some time for question and answer. I didn't see any questions come over, but do we have any that you would like us to address?
Yeah, so as a reminder, everybody, first of all, thank you, Troy and Andrew, for that great presentation. So we'll take the next couple minutes to answer any questions you guys may have. As a reminder, you can submit your questions in the Q&A panel. We've got a couple submitted that I'll read here, but as we're answering these first couple, feel free to type yours in and we will get to those next. So the first one that came through, guys, is are you seeing an increase in the authorization of the 278 transaction adoption among payers?
This is Troy, and I'll let Andrew answer too, but my answer is no. It doesn't really seem to be increasing, and a clearinghouse or someone who would be submitting that authorization, there's just not a lot of activity around it. I know there are companies that are working on it, but adoption has been surprisingly slow. It's nothing compared to what happened with 270, 271, and 837, 835. Andrew, what do you think?
Yeah, no, I echo the comment. Right, it is a bit of it's an older specification as well, right? So it's not the case of it's new and it's going to take some time for adoption. It's been there, right? And the back-end infrastructure to invest in that for a payer is not insignificant. I also think you're seeing the trend of, right, the AIMS and the Evercores that are starting to manage, certain, service lines in terms of authorization content approvals and, decision support related authorization, right? And even there, right, you're seeing that be more portal driven than 278 driven. So yeah, I would agree that in the near term horizon, I don't see that is going to be, an adoption curve that's going to be followed.
Interesting. Thank you for both your thoughts on that. We have one more question as well. How do you keep your payer list that you work with up to date and growing?
Yeah. So there's a few ways, right? There's known connections, right? Like others out in the industry, right? People share. At least on the eligibility side, connectivity payers. So there's kind of like a known list of where we have connectivity to. Typically, the way we do this is rolling out on a client-by-client basis so we can, build that value for that client versus, trying to, spend a lot of resources and time to build connections that don't ever get used. I'd say, on in terms of curating the content, right, that's done on a weekly basis, right? So as we go out, and deploy auth solutions, I'll use that as an example. Not only are we already curating as many rules as we can across all the payers nationwide that publish rules, right, our connections to those payers has also grown over the years, right? So you can get, close to, over 300 or so on the authorization side, whereas eligibility, those numbers, go, close to the thousands, right? So it is something that's curated, managed. It's not uncommon to have, discussions with clients to say, hey, I'm interested with this certain type of plan or this payer that, you know, is a significant volume for me, and let's have the discussion. That'll happen all the time.
Great. We actually did have one more question just roll through. The question is this tool used to determine if a service needs auth or searches for an auth that has been requested anyway?
So yes, the answer is yes to both. So, you know, the most common implementation we see of this is with the authorization status. And that's a really good place to start if you're looking to automate your authorization process. That I would recommend to anyone to start there. And the reason for that is twofold, right? If you're going to work on initiation of an authorization yourself because you own that process, you know, that first auth status check in this, you know, Medi environment really gets you that rule set, right? So it'll tell you if the auth is required or not, and then you can follow a downstream process. But if you're not initiating those authorizations, if that's, you know, occurring outside of the, you know, four walls of your organization, you know, status then does pick that up. Right now, when we actually do this, we're looking at things like dates of service, the procedure type, so on and so forth, so we can be smart about when we ask the question on the portal to get an authorization response. But it does serve both methods of discovering what the rules are for your own process, but also catching everything that may have been initiated outside of the institution, so you can start to identify those things that, you know, are certified or potentially not found, right? That's a common use case to see. Auth hasn't been found because there has been no initiation of the authorization from a referring provider, right? And so the next step would be to contact the provider. So, yeah, there are useful ways that this product can accomplish both of those tasks.
Yeah, and Andrew, you know, made a good point of efficiency is built around touching as few things as possible, and that should be true of the automation also. So Recondo has done a great job of saying authorization is not required for these services, move on to the next task, or authorization is required, we'll submit that authorization, we will access the payer portal, authorize the services, and report back to patient access. So both of those things are key to doing as little as possible, you know, touching only what is necessary to get your patient cleared.
Great, thank you both. So that actually does bring us to the end of our submitted questions. I'd like to take this time to thank everybody who joined us today and to thank you, Andrew and Troy, for the wonderful presentation. I'll remind everyone to look for the slides from this presentation in the coming days. And thank you again and have a wonderful day.